Do your feet look completely normal when you wake up, but by evening, they're swollen, tight, and your shoes barely fit? Most seniors just shrug it off. It's just aging, they say. But here's the truth doctors rarely say out loud. Persistent foot swelling can sometimes be one of the earliest warning signs of a serious health condition hiding underneath. Today, I'm walking you through 7 warning signs tied to swollen feet that you should never ignore, and one of them is so easy to miss, most people mistake it for simple tiredness. Stay with me until the end, because I'll also tell you exactly when swelling stops being harmless and becomes a reason to call your doctor immediately. Here's the thing, as we cross 60, our body just doesn't move fluid the way it used to. Veins lose their elasticity, so blood struggles to travel back up from your feet to your heart. Add gravity into the mix, especially after long hours of sitting or standing, and fluid naturally pools right where you least want it. Your leg muscles, which normally pump blood upward, also weaken with age, slowing things down even more. Your lymphatic system, the body's drainage network, slows too. Some medications quietly cause fluid retention, and chronic conditions like heart, kidney, or liver issues can make swelling worse. But here's what really matters. Temporary swelling after a long day is one thing. Persistent, daily swelling is your body waving a flag and figuring out why it's happening matters more than just hiding the puffiness. Let's understand what's happening because the word doctors use is edema, and it's simpler than it sounds. Edema means excess fluid trapped in your tissues instead of flowing back through your veins. Swelling in one foot tells a different story than swelling in both. One-sided swelling often points to something local, an injury or blocked vein. Swelling in both feet usually points to something happening throughout your body, your heart, kidneys, or circulation. Doctors also check pitting versus non-pitting edema. Press your finger in if it leaves a dent that stays, that's pitting, often signaling fluid overload. If it bounces back, that's non-pitting, pointing to different causes. And here's what people forget. Edema isn't a disease. It's a signal your body is sending. Sometimes the cause is harmless, like sitting too long on a flight, but sometimes it's pointing to something more serious. So let's break down the 7 warning signs. Quick thing before we continue, if this is helping you, hit subscribe. It really helps this channel reach more people who need it. And if someone you know, a parent, a spouse, a friend, has been ignoring swollen feet, share this with them. It could be the nudge they need. Drop a comment too. Has your swelling been getting worse lately? Okay, let's get into it. Warning sign number 1, swelling that just won't go down, even after a full night's rest. Normally, when you lie down, gravity helps fluid drain and your feet look better by morning. But if you're waking up and your feet are still puffy, or the swelling seems to be creeping up slowly, day after day, that's your body telling you something isn't resetting the way it should. Maybe your shoes have been feeling tighter lately, or your socks are leaving deep marks around your ankles that take a while to fade. This kind of pattern can point to chronic venous insufficiency, where your veins struggle to send blood back up properly. In some cases, it can even be an early signal of heart or kidney issues starting to develop quietly in the background. And here's the real danger. The longer you ignore swelling that lingers, the longer a real diagnosis gets delayed, and the more time a serious condition has to progress. Warning sign number 2, and this one you should never take lightly. Swelling that comes along with shortness of breath. If you find yourself getting winded just walking across the room, or you feel breathless the moment you lie flat in bed, pay close attention. Some people even wake up in the middle of the night gasping for air, needing to sit up just to catch their breath. Add in fatigue that hits you after doing almost nothing, and this combination becomes a serious red flag. Together, these signs can point to heart failure, where your heart isn't pumping efficiently enough, causing fluid to back up into your lungs and legs at the same time. This isn't something to wait out or Google your way through. If you're experiencing swelling alongside breathing trouble, please seek medical evaluation right away. And if the breathlessness is sudden or severe, treat it as an emergency and get help immediately. Warning sign number 3, and this one demands your immediate attention. Swelling that shows up suddenly in just one leg. Not both, just one. If that leg also feels painful, warm to the touch, red, or tender when you press on it, please don't wait this one out. This combination can point to deep vein thrombosis, or DVT, a blood clot forming deep inside the leg. Here's why this one is so dangerous. If that clot breaks loose, it can travel straight to your lungs and cause a pulmonary embolism, which can be life-threatening within minutes. Watch for sudden chest pain, rapid breathing, or coughing up blood. These are signs the clot may have already moved. If you notice sudden one-sided swelling with pain, warmth, or redness, this isn't a wait-and-see situation. Get to an emergency room right away. This is one warning sign where acting fast can genuinely save your life. Real quick, if you've ever experienced sudden swelling in just one leg, drop a comment and let me know what happened. Or if this reminded you of someone in your life who's dealt with this. I read every comment, so don't be shy. Warning sign number 4. Pay attention to what's happening on your skin, not just how much your feet are swelling. If the skin over your feet or ankles starts looking shiny, feels unusually tight, or you notice discoloration, especially a brownish tint developing over time, that's a real signal. Sometimes the skin thickens, or you might spot small ulcers, blisters, or even areas that are weeping fluid. These changes often point to chronic venous disease, where poor circulation has been quietly damaging the skin and tissue for a while now. And here's the part that worries doctors: most damaged skin like this is far more vulnerable to infection. Left untreated, a simple skin change can turn into a serious wound that's much harder to heal. Catching this early, before the skin breaks down further, makes all the difference in how easily it can be treated. Warning sign number 5, and this one often gets missed because it doesn't just show up in your feet. Notice puffiness around your eyes, especially in the morning, or urine that's foamy, or noticeably less than usual. Pair that with high blood pressure, ongoing fatigue, or a loss of appetite, and your kidneys might be struggling to filter fluid properly. When kidney function drops, fluid that should be leaving your body stays behind, showing up as swelling in your feet and puffiness in your face. This matters especially if you're living with diabetes or hypertension, since both put extra strain on your kidneys over time. If you're noticing this pattern, don't ask your doctor for simple kidney function tests. Catching kidney trouble early can change the outcome, and it starts with paying attention to signs like these. Warning sign number 6, and this one catches people off guard, because the culprit isn't a disease, it's sitting in your medicine cabinet. Certain calcium channel blockers for blood pressure, NSAIDs like ibuprofen, steroids, hormone therapy, some diabetes medications, and even antidepressants can cause fluid retention as a side effect. Here's the tricky part. The swelling develops gradually, so it's easy to blame it on getting older instead of connecting it to a pill you've taken for months. This is really important. Never stop a prescribed medication on your own just because you suspect it's causing swelling. Bring it up with your doctor instead. They can review your medications and often tell whether your prescription is contributing to the edema and adjust things safely if needed. If any of these medication warning signs sound familiar, share this video with someone who's on similar meds. It could genuinely help them ask the right question at their next appointment. And drop a comment below. Has a doctor ever changed your medication because of swelling? I'd love to know your experience. Warning sign number 7, and this one needs urgent attention, not a wait-and-see approach. If your swollen foot also feels hot, looks noticeably red, and is severely tender, especially alongside fever or chills, your body may be fighting an infection. This could be cellulitis, a skin infection that can spread quickly if untreated. It's an even bigger concern if you're diabetic, since diabetic foot infections can develop from something as small as an unnoticed cut, especially if there's already an open wound that isn't healing well. Here's what makes this serious for seniors. Infections spread faster and hit harder as we age, because the immune system doesn't respond as quickly as it used to. If you're seeing redness, heat, fever, or a wound that isn't closing, please don't wait it out at home. This calls for urgent medical care right away. Not every swollen foot means something serious, though. Sitting for long stretches, long flights or road trips, hot weather, extra body weight, arthritis, varicose veins, thyroid issues, liver disease, lymphedema, too much salt, poor nutrition, even dehydration. All of these can cause swelling too. The point isn't to scare you into thinking every puffy ankle is a crisis. It's to help you recognize when swelling is just circumstantial, and when it's your body flagging something that actually needs attention. Either way, figuring out the real cause is what actually matters here. A few simple habits really can help. Elevate your legs above heart level when you rest, walk regularly, and try gentle calf exercises to keep blood moving. Maintain a healthy weight, wear properly fitted shoes, and stay hydrated. Cut back on excess sodium and avoid sitting in one position for too long. Compression stockings can help too, but only if your doctor recommends them. Managing diabetes, controlling blood pressure, and taking your medications as prescribed all go a long way toward keeping swelling in check. So, let's bring this together. Overnight swelling, breathlessness with puffy feet, sudden one-sided swelling, skin changes, kidney signs, medication-related buildup, and swelling with infection. These are the 7 signs your feet may be telling you something. Swollen feet aren't just normal aging. Watch for changes and get evaluated early before complications develop. So tell me, how often do your feet swell? Does it happen in one foot or both? Drop your answer in the comments. I really do read them. And if this video gave you something worth knowing, subscribe for more evidence-based videos on healthy aging, circulation, heart health, kidney health, and staying mobile after 60.